Hi, I'm Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. I've been trained directly under Dr. Alfredo Hoyes and Dr. John Millard for visa liposuction, and Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift, and also under Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. It can sound pretty unbelievable for many if I were to tell you that some men are very concerned about how their nipples look like, how the shapes, how big is the nipple, whether are they visible, protruded when wearing clothes or when they're not wearing clothes. The size and appearance of men's chests can significantly impact one's self-confidence and self-image. When it comes to aesthetics, the focus is not just on well-defined chests, but also male nipple. Despite being smaller than female counterpart, a man's nipple can present aesthetic concern related to male nipple aesthetics and may cause discomfort and embarrassment. Male nipple protrusion, also known as overly projecting nipple, is an aesthetic concern for men and often cause them embarrassment as they find that when they're wearing clothes or when they're not, it can be particularly visible, especially it may vary under different weather conditions, under different emotional condition as well. It is possible to reduce the size of a nipple and make them smaller and less conspicuous. Surgery for nipple reduction is rather straightforward and simple. It can be done usually in less than an hour. A patient can return to home after surgery. Downtime, pain, discomfort is rather minimal as it affects only the nipple and areola region. So patient can basically return to close to 90% of their daily activities after surgery and return for wound inspection, removal of stitches after 2 weeks, and after that they can resume full activities. The results are relatively permanent as once the size and the shape is being altered, it will remain very constant and regardless of whether they gain weight, lose weight, getting older or not. So when we assess a patient coming in concerned about the nipples size and shape, we often want to distinguish or differentiate them from patients having gynecomastia or pseudogynecomastia or just purely enlarged nipple. And in many cases, it could be a combination of any of those because the underlying cause for each and every one of them is different and treatment is different as well. So if you apply the wrong treatment to the wrong condition and expectations, then we may not be able to get the results that patient is looking for. Assessment, consultation, investigation is a crucial step to explain to patients what the conditions are and to further plan out proper treatment for them. So when a patient comes in to complain about having puffy nipple, the first thing that I need to look at and differentiate is whether the puffiness or what they're concerned of, is it due to the nipple? Is it due to the shape and contour of the areola? Or is it due to the breast tissue, the glands, or the fatty tissue? Patients often confused. They feel or they thought themselves having puffy nipples. It could be due to any of those conditions. Enlarged, elongated nipple or puffy nipple affects not only men but women as well, especially for mothers post-pregnancy, post-breastfeeding, which typically may cause their nipple or areola to be affected in size and shape. We have done surgeries on patients, on mothers, on ladies. Well, some studies have stated that inverted nipples affect up to between 2 to 10% of women for nipple reduction as well. Indicated as many as 10 to 20% of women are born with one or both inverted nipples. The condition can be caused by either congenital, which means you're born with it, or acquired, affecting one or both sides. It can happen in both men and women, causing discomfort and functional limitations. So there are 3 grades of nipple inversion. Grade 1 is what we consider an inversion, which can be easily pulled out with gentle palpation or manipulation with your hand or fingers. It maintains its projection well without traction. Grade 2 indicates that the nipple can be pulled out by palpation, but with much difficulty, and it tends to retract spontaneously after that. So breast glands, lactiferous strand may be retracted as well. Grade 3 is the most severe form of inverted nipples where a significant inversion occurs, trying to manually pulling out of the nipple is almost impossible. There's significant fibrosis beneath the nipple and surrounding soft tissue. So what are the issues that can be caused by inverted nipples? Obviously, cosmetic dissatisfaction among those who are affected. For mothers, for ladies, it prevents the ability to naturally breastfeed. Soreness of nipple, soreness or inflammation during breastfeeding due to clogged milk ducts. And a suddenly inverted nipple can be signs of underlying organic condition, be it of inflammatory disorders, cancer, infection, or anything else. Let's talk about how to fix inverted nipples naturally. It is particularly useful for breastfeeding mom, especially for those with grade 1 or grade 2 inverted nipples, to allow them to have breastfeeding without any obstructions or discomfort. So first, we talk about suction method. These are used by gently pulling the inverted nipple outwards. First, I would like to talk about suction method. There are some patients that address the inverted nipple using suction devices, such as nipple retractors, nipple extractors, or suction cups. These devices are typically worn beneath the clothing or bra for a period of time. It works by gently pulling or sucking the inverted nipple out with the aim of loosening the surrounding tissues. It allows mothers during breastfeeding to enable them to provide a smooth breastfeeding routine. The second will be syringe method. Mothers will advise to use 10 cc inverted syringe before each breastfeeding sessions. It involves placing the base of the inverted syringe over the nipple and gently pulling it out until the nipple was inverted. The last was Hoffman technique. It involves just using your hands. It encourages nipples to protrude, placing your thumbs on either side of the areola and press it down while pulling the thumbs apart. All of these methods can be tried or attempted by mothers with grade 1 and grade 2 inverted nipples. However, if the patients are grade 3, it's almost impossible to retract it naturally, and surgery is the only way to address this issue for those who are affected. So what kind of surgery can be done for correcting inverted nipples? There are basically two types. Inverted nipples correction with preservation of milk ducts, especially for patients who are between grade 1 to grade 2, and inverted nipples correction with detached milk ducts, mainly for patients who have grade 3 inverted nipples where there is dense fibrosis. Release of the milk ducts is necessary to revert or to restore the condition. After surgery, it's important to have few days rest to allow wound recovery, avoid heavy lifting and water activities. Other than that, most daily activities should be able to be performed by patients. For wound care, itchiness may occur as the wound heals. So anti-itch medication, avoid scratching, moisturizing cream, wound dressing, so on and so forth may be useful. Scarring may happen. It's typically located within the areola to minimize visibility. Thank you for listening. If you have any questions, just email us. See you again.